Welcome to MedTech Minis on the JADA System. Today, we will be taking a look at the nurse's role in JADA placement. Hi, my name is Aleesha Moffett, and I am a labor and delivery nurse at CHRISTUS St. Cabrini Hospital in Alexandria, Louisiana, and I am here to provide a nursing perspective on JADA. Building on the last video about preparing for the use of JADA, we will now talk about how a nurse assists in the placement of and treatment with JADA. In an abnormal bleeding or postpartum hemorrhage situation, ideally, the provider would obtain informed consent from the patient prior to initiating treatment. However, the nurse can assist and help explain the process to the patient and their support person. It is helpful if the patient knows what to expect with the device placement. Mainly, what is the process? How long will it stay in? How do we know if it's working? And how is the treatment discontinued? Once the JADA has been requested for a patient experiencing abnormal bleeding or postpartum hemorrhage, a nurse should be getting the device, removing the air from the cervical seal, and filling the 60 ml syringe with sterile fluid to use in the cervical seal. Next, the nurse should be checking that the vacuum pressure is set at 80 millimeters of mercury plus or minus 10 millimeters of mercury while occluding the end of the tubing. If there are multiple nurses in the room, work together. One can test the wall section while another prepares a syringe or removes the air from the cervical seal. Next, the nurse should ask the healthcare provider if they have completed a manual cavity sweep and then swiftly hand JADA to the healthcare provider for placement, filling the cervical seal with 60 to 120 ml of sterile fluid. Lastly, connect suction to the end of JADA. One important note: try to ensure that the provider is doing a thorough sweep of the cavity right before you hand them the device to place. This will help minimize the buildup of clots in the uterus before placement. Institutions vary in how JADA may be removed. In some, the provider removes JADA, and in others, it could be the nurse. What is important here is that there is communication between the provider and the nurse. Both should be on the same page with the time frame for treatment, how long to keep suction off and the seal deflated, and then when to remove the device. As patient advocates, it is important that throughout treatment you provide an ongoing explanation to the patient and their support person. Per your clinical judgment, you can allow the patient to hold, bond, and feed the baby post-placement and during active treatment. Median treatment time is only a few hours, so routine postpartum care can usually take place. Thank you. This has been MedTech Minis on the JADA System. For more information, visit thejadasystem.com/training.